Hi there, I'm Wiley Petersen here with the Metabolic Clinic of Idaho, and I just want to say that we're super excited that you're watching this video, that you've taken the time to schedule your comprehensive wellness evaluation with us. We want to congratulate you on taking time out of your busy lives to focus on you and your health and really your life. We look forward to working with you. We created this video to help you prepare for your comprehensive wellness evaluation and kind of know what to expect. We also want to explain kind of our approach to healthcare and what you can expect from us. And so with that, let's get to it here. So this, what we do is really all about you. It's really about helping you get where you want to be from where you're at, and we want to. It's really about creating the right approach, kind of figuring out where you're at, and then creating that roadmap and that journey, that guide of where you want to be and how we can get there. And we'll go through, you'll fill out your comprehensive wellness evaluation form. We'll review that prior to meeting. Then when you come in, we're going to go through all of your health concerns, what you've tried, how is this impacting your life, those sorts of things, so that we can then figure out, what it is, what's the appropriate plan of action for you. And then we develop a personalized plan for you to help you get where you want to be. We want to kind of talk about our current situation with healthcare, right? In that the majority of people are not in optimal health, and that's not a surprise. Most of us know that. What we currently have in our healthcare system is sick care versus it's not healthcare, right? Most people are sick, they just don't feel good, and you go in to see a provider, then you get treated, with other medications, basically you're getting treated, symptoms are being treated instead of actually the cure or figuring out the root cause. And so part of the reason is that we kind of expect health insurance to cover our our health care concerns and prevention. But if you see this quote from Medicare, they say that care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. So health insurance really is there to provide medically necessary care. So prevention is not medically necessary. It only becomes medically necessary when you have a disease or you have a problem. Now they want to step in and treat that. And so we need to kind of shift our mindset from expecting health insurance to cover everything, and we don't have to invest at all. Instead, start to think of your health as your most important asset. It's your health, and it's the most important thing that you have. If you don't have good health, what good is it to have all the money in the world? It's really important that we start to see that for what it is, in that our health is the most important thing that we have. Your health is an investment, and so the challenge, right, with being healthy and finding and getting, changing our health, is that there's so much information out there. There's a lot of different fads and just misinformation. It's hard to sift through all the things out there and figure out what's true and what's not, what can be done, what can, and it almost gets to the point where we just get overwhelmed and we just say, well, it's too confusing, it's too hard, so I'm just not going to do anything, right? Which is not a great plan of action either. We all want the most efficient pathway, right? The easiest pathway to get the results we want. Unfortunately, people, there's things out there that just they present like they're the easiest way to get what you want, but really they're not going to get you where you want to be. They're not going to get you the results you want. And so we are here to help you learn and implement what truly works, and we're also here to guide you through the process, and we'll talk a little bit more about that here in a few minutes. So when it comes to our healthcare, we have to be proactive, right? We can't just sit back idly by and expect that we're going to get healthy without any effort, right? And unfortunately, we all know what it really takes to be healthy, or we kind of know, I guess. But it's funny, like this picture here, a person realizes how important it is for her dog to go for a walk, get some exercise, but they aren't doing it themselves. And so, we want to empower you. We want you to be proactive. We're going to be your guide. We're going to kind of be a partner with you and walk with you, but we're going to hold you accountable and expect you to make some effort and make some changes. So that's kind of the goal here, is that we, change is hard until staying the same is harder. And but we're here to help you and make it as easy as possible. And so a great example of somebody that's proactive was proactive is Jack LaLanne, right? He's at age 15, he heard a message about nutrition and how it can, really help you feel better and live longer. And he took that to heart. He became proactive at a young age and became kind of what is known as the father of fitness. All through his life, he was proactive, eating healthy, living a healthy lifestyle, being the example there, into a ripe old age of 96 years old. And so he's a good example of what it means to be proactive, and just what that means for us at any age, right? From early on as kids to as we get into our older age. And so it's important to be proactive and take your health as your greatest investment. So with that, we have these programs, these processes that we will help you through. And this quote says it great: "Tell me and I may remember, show me and I will remember, involve me and I will understand." And so we will have you be involved with the process. We see you as a partner and not just as a patient. We're not just going to just tell you what to do. We're going to actually help you, and we're living it ourselves. And so that's kind of the our focus is to really help you in this journey. We in our programs we focus on the 5 pillars of health: nutrition. We all know that it's important to eat healthy, provide your body with the right fuel sources and the right types of vitamins, minerals, things like that. And so we help you with that. We will focus on detoxification, which is your body's way of processing and eliminating toxic or waste products to be more efficient, so that your body is able to operate optimally and feel better and heal. We also will focus on hormone balancing, optimization, hormones, all the different types of hormones. And so that's an important aspect that often gets overlooked in healthcare is hormone optimization, as well as fitness. We will focus on getting out there, moving more, depending whatever your fitness level is, we'll help you figure out like how to get started with that, or where what changes need to be made in your fitness levels. And then another aspect that is often missing in many wellness programs is the mentoring. We have mentoring available. We'll be walking with you through this. We've got a community set up for you to help you. So it's the support is there. It's all, and all this together creates our system, and this is something that you will implement for the rest of your life, right? This is not just a short-term thing that you're doing for a certain period of time and then you're done. This is something that we want you to take this on as a lifelong journey, endeavor, and that we want you to be have health independence for the rest of your life. We want you to have a nice long life and a nice long health span as well, so that you feel good for most of your life. And so if you think about, like, if we were to remove one of these pieces of the system, would it be as effective? Would it be as optimal? And the answer is no. We need all of these systems in place, and we provide that for you so that you can get off the path to disease and get on the path to vitality and optimal health and feeling good for all of your life. And so with that, we want to just a few reminders. Prior to your comprehensive wellness evaluation, please be on time. Please bring your spouse or partner. Have them watch this video before they come as well, so they kind of have a little bit of an idea of what to expect. And it is crucial that you bring your spouse or your partner, in that they will be there to support you and help you make the decision, if that's kind of what we decide to do in your health. And then come in ready to talk about your concerns and your goals. Think about where you want to be in the next 6 months, in the next year, 5 years, 10 years down the road, things like that. And then come in, be ready to make a decision, take some action, because as I've mentioned before, it's really change. Change can be challenging and hard until staying the same is worse, right? And so we want to see you make these changes and really take the step. We commend you and congratulate you on taking this first step in changing your health and changing your life so that you have long life and vitality. And so we look forward to meeting you and working with you, and we'll see you soon.